I'm skeptical as a guy of any face products, but when I was sent the Amora, I said, you know what, let me give this a try. So as David pointed out, I'm an avid golfer, but our golf season ends in like early December, so I was using Amora December, January, February, March. I show up at the club, end of March, and my caddy master's looking at me funny, and he says, what have you been doing? I said, what do you mean? He goes, you look 5 to 10 years younger. And I said, really? He's like, yeah. Well, you know, when I look at myself in the mirror, I don't really look as a guy, like, hey, I look younger or not, but my sister-in-law, who also works at a dermatology office, also said the same thing. She goes, what have you been doing? So I gave her some Amora samples, and she started using it. She talked my brother into investing in the company. So there's some real, I really use Amora every day now. After hearing these kind of things, I was like, wow, I might as well keep using it. I'm here today to talk about ACTIVZ, and I was less nervous about talking about it until people started coming up to me yesterday and today and saying, we're really looking forward to hearing you speak about it. So, what ACTIVZ is, David had it as Product X for the longest time, so we couldn't say what it was, but it's a curcumin product, and basically it's tetrahydrocurcumin, and I'm going to talk about the effects it has on pain and inflammation. It has a lot of benefits, and I honestly believe, I've been on it for 2 months, and I can tell you, if you try it, you will know that it works. I'll just give you an anecdote. As far as I'm concerned, like David said, I'm an avid golfer, and I generally take a lot of ibuprofen before the round, after the round, and I've been on this for 2 months, and I can honestly say I don't remember taking ibuprofen. And normally I would just reach for it. So I think for normal aches and pains, this works really well. So just general definition of inflammation and pain. I don't particularly like these definitions, but inflammation is basically the body's response to an injury, to tissue, or an infection, and basically it's trying to heal you. But the problem is when the inflammation goes haywire, that's where you run into trouble, and it can lead to longer lasting diseases and things like that. Pain is basically physical suffering caused by an illness or injury. So you can see that there is a link between inflammation and pain, usually, and pain is a signal that the brain gets to start all this process. But the problem is, with chronic inflammation, it can lead to diseases like heart disease, osteoarthritis, a bunch of other problems. And so to preemptively head it off is a better situation than trying to reactively treat it. So pain is the most common complaint seen in the doctor's office, because people don't go to the doctors unless something's wrong. And usually it's the pain, no matter what kind of disorder it is, that sends a signal to the brain saying something's wrong, let's go see a doctor. So that's, as an interventional pain specialist and an anesthesiologist, that's what I see mostly is musculoskeletal pain. People come in from like simple aches and pains that are lasting longer than a week, all the way to disc herniations that are causing sciatic pain or neck pain radiating to their arms. That's basically what I see. Now, there's acute pain and there's chronic pain. Acute pain is more treatable because you can actually see what the injury is or what the problem is, and it's easier to treat. When it becomes chronic, which means it lasting longer than 3 to 6 months, it becomes harder and harder because now it's gotten into people's head that they're in pain and they're taking medications, and it's very hard to wean them off these medications. The medications most commonly used, I've listed here. Most of them are non-steroidal anti-inflammatories like aspirin, ibuprofen, which is Motrin or Advil, naproxen, naproxen, meloxicam, which is used in osteoarthritis a lot, acetaminophen, which everybody knows is Tylenol, and Celebrex, which is a COX-2 inhibitor, which was supposedly designed to reduce the GI effects, the side effects of these other non-steroidal anti-inflammatories. Now, Tylenol, everybody, it's not really an anti-inflammatory. It works centrally in the brain. The problem with Tylenol is it doesn't affect your stomach, but it can cause significant liver damage, and actually in small doses in certain people. Everybody probably knows about the opioids with the opioid crisis. These are the more commonly prescribed opioids that I've listed here, but there's plenty more. Percocet, Vicodin, I'm sure everybody's heard of. That's usually the most common. Fentanyl is usually used more for cancer pain and things like that, with patches. And morphine is the most common narcotic. Also, you can use steroids for inflammatory pain. Basically, prednisone and medrol dose pack. I'm sure there's women in the audience who've been on either prednisone or medrol dose pack, who gain weight and have water retention. So that's the biggest complaint I hear from people who are on these medications. So as you can see, all these medications come with side effects. Now, I'm going to talk about tetrahydrocurcumin. It comes from turmeric. Turmeric is from the ginger family, and as you can see, it's a root similar to ginger looking on the outside, and the scientific name is curcuma longa. Turmeric has been used in cooking in Indian culture for forever, and it's the main ingredient in curry powders, and it's also used to color foods. And what this comes from is what's called Ayurvedic medicine, and that's a Sanskrit term. Ayur means life, and Veda means knowledge. And the Hindu mythology is that the gods passed down this medicine from them to the sages, and the sages passed it on to the people. And it dates back to the Indus Valley civilization and probably even beyond that. And it's used as an anti-inflammatory, antibacterial, and an enhancer of digestion in Ayurvedic medicine. Now, I grew up with an Indian mother, and I remember spraining my ankle when I was a kid, and she would make a paste out of the turmeric powder and salt, and put it on there and wrap it. And sure enough, the next day I woke up with less swelling, less pain. So even as early as when I was 5 or 6 years old, I can remember that. So curcumin and tetrahydrocurcumin. Curcumin is the principal curcuminoid that comes from turmeric. The problem with it is it's unstable. So it's not as bioavailable, so it doesn't get into your bloodstream to give you all the positive benefits. So usually turmeric also, you need to take take black pepper with it, because it contains a molecule called piperin that helps in absorption of curcumin. But tetrahydrocurcumin is a product of bacterial or intestinal metabolism, a reductase enzyme that makes it into tetrahydrocurcumin from curcumin. So what this proprietary product is actually tetrahydrocurcumin, so it's easily bioavailable and will give you all the benefits that normally you wouldn't. So the benefits are significant. Aside from the pain relief, which you can actually feel, there's a lot of stuff going on inside your body that's more dramatic and better for you, but it's harder to see. It's a significant antioxidant. Now, I'm sure everybody's heard of free radicals. Free radicals are what happens when the body breaks stuff down, like food, alcohol, people smoking, all kinds of stuff. It cause free radicals, and the most common ones that you hear about in the media are vitamin C and vitamin E as free radical scavengers. But curcumin is a significant antioxidant, and what that does, in conjunction with its anti-inflammatory properties, is it can prevent heart disease by stopping damage to your endothelial cells in your blood vessels. There's so many benefits to that. The anti-inflammatory effects. So when David first approached me with this, he sent me some samples and said, can you give it to some of your patients and see what they say? So I gave it to a few people that I know were skeptics. So I said, if these people like it, then I know it's going to be good. So I gave it to my head golf professional who suffers from rheumatoid arthritis, really young guy. And I said, Bill's going to be very skeptical of this. So 2 to 3 weeks after he started taking it, he comes up to me and goes, Doc, I'm shocked. I go, what do you mean, Bill? He's like, oh, I thought it was going to upset my stomach because I'm on Enbrel. Anything I take upsets my stomach. He goes, nothing like that happened. I said, well, did it give you any benefits? He goes, well, one thing I noticed is I'm taking a lot less Enbrel, which I was taking on a regularly consistent basis. So after 2 weeks he's had that, so I'm going to follow up with him some more and see how much more that affects. Then I gave it to my best friend's mom, who I know for years, and she's very skeptical. She has osteoarthritis in her fingers, really bad, and so I said, listen, Dan, try this. So she started taking it. 3 weeks later, she calls me. She's been taking Celebrex for her osteoarthritis for years. And she said, I can't believe it. I've only taken 1 Celebrex this entire week, and I was like blown away. So these are just some of the people. Even my mother, who has osteoarthritis in the knees, she loves it. She had been taking turmeric since she was a believer, so I knew she was going to be happy with it. The other benefits are significant as well in terms of digestion. I mean, there's been a lot of studies with irritable bowel syndrome and ulcerative colitis, and actually it's being studied heavily as a colon cancer prevention. And there's even some studies where they think it helps people with cancer, but that's still in the process. The thing is that there was a lot of the studies before that were done were curcumin, which was unstable, but now that they have tetrahydrocurcumin, which is very stable, I think you're going to see a lot more benefits. So that's basically what I wanted to convey to you. If you guys have any questions, I had a lot of people approach me yesterday and today saying that they talked to their doctor about Optimend and they want him to speak to me. I'd be more than happy to. And I will share, and anybody can get my email through the corporate headquarters if they'd like, my phone number, information. I'm more than happy to help everybody out. It's been great meeting a lot of you today, and I just sense the energy in the room.